Um, he stole my question about the old age health insurance scheme, actually. This was a really prominent part of Tsai Ing-wen's platform when she was running for office. And so she's going to be on the hook to introduce this. And is there an indication of where the revenue to support this would come from? Is it going to be
payroll tax?
Payroll tax.
Yeah,
okay.
Just the same thing. I think
so the same thing that they did when they introduced the dual system.
Yeah. So what I think the proposal on the table before is that it's going to be run by National Health Insurance Administration, but financially they will be independent. But they will use the agency to run the scheme so that there was economies of scale. But it will be sort of financed separately, and I bet the government still will pay a big chunk. Okay. If not, 30, again, 1/3 of the.
Given your comparison with Taiwan and Korea, are there rumblings in Korea of introducing something similar, or do they already have a?
You mean their long-term health insurance?
Long-term health
insurance. They did.
Yeah.
I think they introduced the scheme. Let me see. In year 2008 or so. Yeah, they already have the scheme, but again, South Korea, they will have any scheme in place, but they always provide very limited benefit, and they also have a case management. So, it takes some assessment for you to be eligible to get the benefits from the system. And what they did, again, is run by NHIC, the corp, and it's financially is separate. I think it's like 1.5% on top of their national health insurance premium. So you pay again on payroll. So they collect the money through the same channel. So I mean, again, it's for administrative sort of efficiency. Yeah. So they have that scheme. I remember it's like year 2008. So it has been some time.
Okay. Yeah. So Taiwan is actually following South Korea on this particular benefit.
Yeah. I mean, their economy is doing so good. What can you do? I mean, it's really whether you can exercise the
but they have
source.
They have a lot of the same demographic issues that Taiwan has.
Oh yeah, the elderly proportion is, I think it's 15 now for South Korea, slightly higher than Taiwan. Yeah, but their average wage rate has been increasing for the past decade, where Taiwan just stagnated. Our wage did not increase for more than a decade. I think I'm getting paid just roughly the same as 20 years ago when I started in Korea, which is really sad. And my kids are growing up,
Yeah.
Yeah. So, but anyway, life goes on.
Are there other questions?
Yes. But isn't it true, say, if you take the issue of long-term care, it's a form of social transfer payment? Because on one hand, you give money or whatever is through insurance, to the people that need the care, and that hands out to the people that provide service, which is a form of income. So this is really like a form of transfer payment. I mean, if you want to create employment for people that have nothing else to do, that may be, a way to create more employment out of the whole thing. I mean, we are seeing this in California. I mean, people mention the in-home support services. All of a sudden, there are people. It's like forcing the state $5 billion budget.
Yeah, the thing about long-term care insurance is, I think the moral hazard issue is even greater.
Yeah.
Yeah, because some of the care can be provided by the family members.
Yes,
so
exactly.
one of the questions that has been discussed is that whether do we pay the family member to look after the elderly, which in the case of Germany they do. They do pay the family member, but then what is likely to happen is, what if the family member take the money but not looking after the elderly? And then the other protest would be from the females. It's like they assume, especially in Chinese culture, Taiwanese culture, the same. If there's a job that pays you to look after the elderly, I mean, your family is going to be a lot of pressure on you for you not to go to work, because you say, well, it's better if you look after. Same thing with the childbearing business, right? If someone is paying you to look after the kids, it's unlikely. Well, I shouldn't say unlikely, but there will be a lot of stress on you whether you actually can get to work, and so to your maximum capacity. Yeah. So I'm lucky or unlucky.
I actually have another question, which is sort of an out-of-box question. If you look at the longevity, the demographics, the lack of jobs because of automation, all those things. Isn't it true in the long run, this whatever healthcare system, whatever it is, will be drastic change, or what is your prognosis on that? I mean,
well, in the long run, we'll die.
As John Kane said, in the long run, we're all dead.
We'll die.
But the country hopefully will survive.
Oh yeah, definitely. For our children.
Presumably, all these East Asian systems are heading for big crisis.
Yes, exactly.
Because of the aging demography.
Exactly. It's
Yeah.
the dilemma that all advanced industrial countries face.
Yeah, and especially Taiwan, who has sort of the lowest fertility rate for more than 3 decades.
But Taiwan is doing a better job of managing costs than the United States. Why do you think, maybe I can flip the question in a way, just to get your perspective, why is it so darn expensive here compared to Taiwan and Korea?
Well, because the medical professionals get paid so much better in the States. So if my husband is a surgeon, if he works in U.S., I don't think I have to work. Well, which is not true. I will work anyhow, even for low-paid job. But I think he will be able to support the whole family with 3 growing boys. Yeah.
Maybe you'd like to say that to our colleagues at the medical center, how they react to it.
Well, and the medical professionals in Taiwan work extremely hard, seriously. And this is a very particular generation. I don't think the younger generation is taking up on that spirit. So this will be our worry. My husband said he's a surgeon, and when he was a resident, he always made sure, he would not leave his post until the professor comes in, check on every patient. So even if the professor, supposedly he's supposed to get off at 8 o'clock, and the professor coming at 10, he'll be still there. So he'll wait. These days, he'll be like running out of the door at 7:30, so that he will get to see his resident, because the resident will just leave without seeing him, without telling him what's going on with the patient, without reporting to him. They will just leave. They don't care. It's like, I'm supposed to get off at 8, and therefore I'm getting off at 8, if not earlier. So he always dash out of the door by 7:30 to the hospital, so that he does not miss anything. So the mentality really changes too, and so that would be our worry.
So the supply of doctors may diminish in Taiwan?
Well, it's fixed at 1,300 slots. So every year they recruit 1,300 medical students. It is fixed because the government has to pay a lot too. They subsidize the medical schools. The private one and the public one, they all have to subsidize. So the government said 1,300. And also health ministry, for years, they have argued that we have ample supply. And if you look at the ratio, physician per 1,000 population, our number looks low compared to OECD. I think OECD is 2.5. Ours is always 1.8 or so. But then they say, well, because Taiwan is small, it's, transportation-wise, it's very easy. And within medical center, they can see tons of patients in one day. So we don't actually need that many physicians. And so to resolve this sort of distortion in specialty choice in Taiwan, the government started a new public doctor program. So they are giving out another 100 or so, I think 200 per year, sort of medical student enrollment. And what happened was only one medical school actually has enough. So if they have 15 slots, they were able to recruit 15 medical students. The rest of the medical school did not have, they did not have enough. And the reason is that it's a public doctor program. So even though tuition free, and then you get stipend, but upon graduation, they will assign you to sort of specialize in these 4 major specialties, which has problem in recruiting residents. And also they will assign you to places of in terms of location of practice. And these days, I guess they just can't afford medical school education. They don't care about that. So they decided not to go. So only one medical school out of 6 was able to fill up the spots. The rest of them all have half of them empty. They were up for other. They can still, these must be good students, so they can still go to other medical schools, but not in the public doctor program. So that is the worry. I mean, even with all this, bonus offer, they still have a problem in recruiting enough medical student. We are only talking about medical student here, not even residency. So the physician supply definitely will be a huge issue.
Then you'll have to import people.
Well, that's the thing. We have a very strict immigration policy. So
And
there are a lot.
If I can just ask one other question, because we have such a massive deficit of nurses here in the U.S. We have to import nurses. What about Taiwan?
Taiwan too. We are losing nurses to U.S. and to U.K. Essentially, seriously. They offer them, green card, upon your arrival. So we are losing a lot of nurses to U.K. and U.S. Yeah, so that's an issue too. The nurse shortage is a global phenomenon, actually. So I've been seeing a lot of nurses actually from India or Philippines where they were trained in English. And in Taiwan, only probably high-end, people with a higher degree, they can actually be able to work here. But they are really like skilled nurse, but when they are here, they're actually working sort of the low-end. Sort of less skilled nursing jobs. Yeah, but I guess they want to live in U.S. I guess, and the pay is much better than Taiwan too. So we're losing people to you.
Would it be smart to import like more from Middle East and South
Language.
America?
Language will be an issue because in Taiwan, people speak Mandarin and Taiwanese. English is not that popular. I mean, it's a course offered at school, but still, I mean, people are not really fluent in
Even
English.
in the medical school.
Yeah. So Taiwan, for the past few decades, I mean, for the past at least the past decade, Taiwan has some of the major hospitals have tried very hard to promote the medical tourism. And so the challenge they face is to have enough medical professionals who are fluent in different languages to be able to look after them. And so that they are sort of putting people in training, but still I think it's a long way to go because it's an island, and so we are isolated in a way. Yeah. So there's a lot of sort of social environment disadvantages in terms of having us going global, not to mention threat across the strait.
Well, we are just about out of time, so I want to thank Dr. Liu for giving us an astoundingly complex and rich presentation today. And that concludes our formal events for this semester, this quarter. We'll start back up in the fall with another round of programming, but I thank you all. I see a lot of regulars here today. I thank you all for your attendance over the past year. We've done a lot, and I appreciate your support and continued interest in the Taiwan Democracy Project.